one person dead.
Yes.
Unfortunately, a medical staff.
Yes.
And then we've had 8 now suffering from Ebola. And you are managing all those in Mulago Hospital.
We are managing 7 of these are in Mulago.
Yeah.
And 1 is in Mbale Regional Referral Hospital. But what is
the contacts, the 280 contacts?
They are quarantined.
Oh.
Yes. And
how long is the quarantine?
21 days.
21 days, okay.
So because the incubation period is usually between 2 days to 21 days. So usually when you quarantine people, within 21 days, if Kabando, Fono, Pondo, Moses had got the virus, the signs and symptoms will be
manifested.
Manifested.
In those days.
And it will be easy for us now to start managing. But the uniqueness of this outbreak and why initially even the international community was concerned, all the Ebola outbreaks we have had in the country have been far from Kampala. So this was a very special case that the index case was a health worker. And of course, we have many of our colleagues who have been quarantined and health worker and in Kampala. And you know what that means. If you get an outbreak in Kampala where you have many people,
disaster.
Yeah, it's a disaster. But if it was, for example, if we had this case 20 years ago in Kampala, it would have been a different situation now in Kampala. So the experience.
So what you're saying, Dr. Kabanda, is that we have ability to manage. It is not a God's case, you know. Sometimes you think you're in Uganda and we are living by God only.
It is actually not by chance.
Okay.
Yeah, it's not by chance.
What about Mpox? That's an update on Ebola.
Yes, for Mpox, we have so many cases, over 2,700 cases
of Mpox.
And
Nafka is in the studio. Most welcome, Marianne Kasule Nafka.
Thank you, Oscar. Good morning to our listeners.
Yes, and we also have your microphone is not on, Moses, so we don't have personal. Malcolm Pamizo, another lawyer in the studio. You're most welcome to Gang.
Thank you, Oscar.
Happy New Year to you. I haven't had you forever.
Happy New Year to you too.
Doctor, you're using a very calm voice until Namfuka came in, but you need to tell us 2,700 in terms of a 40-something million Ugandans is a very, very few.
Namfuka that we don't live by chance in Uganda.
No.
Things are happening because they are capable hands.
And in terms of statistics, that's not so many. But continue, Doctor.
Okay, if you look at it in terms of the 46 million Ugandans, to those who believe in, to the quantitative experts, if you look at it from that, then you will get it wrong. I just give you an example. For example, if you look at the amount of money we invested in managing Ebola, last time we had close to 150 cases, only 150 cases. But you see, we are concerned about the fatality rate, say for Ebola, for example. In countries that failed to manage Ebola, over 50% of individuals who get the disease end up dying. And they die within the shortest period of time, between 8 to 10 days.
In fact, it was far more than 50%.
So, but in the last outbreak,
90%?
In the last outbreak, the fatality rate was below 40. It was around 39%. So, but currently, out of 9 cases, you have 1 person who has died, and 8 of them are very stable. And as I said, that doesn't, it's not by chance. So, it's out of. No.
But first go to the Mpox, you're saying.
So for Mpox, we have over 2,700 cases.
In Uganda?
In Uganda. The beauty with the Mpox that within 4 weeks, to some individuals, they even get healed without going to hospitals. In hospitals, we have individuals who have been severely hit. And the beauty with Mpox, you can easily avoid it if you don't get involved into reckless sexual behaviors. The most route of transmission is through sex. And so if you don't get involved into reckless sexual behaviors, definitely you can easily avoid it. And also the case fatality rate. So out of 100 people, you expect to get less than one person. I would say less than one person dying on average. For those who love statistics, almost 0.6% individuals end up dying. And that partly explains why, for example, the concentration, when you get a severe or you get an outbreak, for example, of Ebola, all the efforts are geared towards addressing the Ebola outbreak. But I would say we have a number of cases in Entebbe. We also have cases in Masaka. We have cases in Imbalala of Mpox. And we are not so much worried of Mpox treatment because in many of our regional referral hospitals and general hospitals, these cases can easily be handled from there. But of course, also we know that the rate of transmission from one person to another for Mpox is really very low, unless if you get involved into sexual practices. Yeah.
Very soothing. And then final, there's a conspiracy theory that whenever we don't have any money, whenever Ministry of Health doesn't have any money, they create these epidemics so that they can get some funding. What would you say to that? And Namfka, right next to you, is one of the peddlers of those things.
It is sad that we have people who think like that. I tell you that
we don't. We've been part of it.
Outbreaks are so much draining, both for government. The amount of money, for example, government loses when you have an outbreak of Ebola is much more. It can even be thrice the amount of money you may get responding to the outbreak. So we lose a lot of money. We have so far lost a lot of money as a result of some people cancelling, coming here and holding meetings here. So when we come out to declare an outbreak, we don't do it as Ministry of Health alone. There are other key institutions that must also confirm that indeed there is an outbreak in a country. We don't declare without World Health Organization, for example. We usually declare when we have our colleagues from Centers for Disease Control. So, but the beauty, for example, for Mpox, finally, is that we do have the vaccines in place. And for the high-risk groups, like, for example, the commercial sex workers and all that, we have been able to vaccinate them. And that's the beauty for Mpox. So we just call upon members of the public to be alert and to ensure that, for now, people can try to postpone their urge for sex, especially for individuals who are not their usual partners. Yeah, that's the only way we shall be able to prevent. Yeah.
And then we've had a problem with USAID that has been funding a lot of Ministry of Health projects, works. So how is the ministry preparing for those funding gaps?
First of all, when we get outbreaks, most of the funding comes from government because the biggest resource in responding to outbreaks is more centered on human resource. And we are here. Government pays us as scientists. So that's the biggest resource that government has, and also in terms of infrastructure. Because the cases that we do have are all housed within the government structures, the government health facilities, currently Mulago and Imbale. And of course, for information, when we have epidemics that are serious like Ebola, we don't allow the private sector to manage because they don't have the capacity. They don't have the capacity to manage these conditions. It is also one way how we can be able to prevent infections in most of these facilities. Back to funding, yes, it is true that when we have outbreaks, many partners usually come on board. And there has been a freeze of resources from the U.S. government. But I will tell you that currently the U.S. government has been able to commit most resources towards the Ebola response. So
even now?
Even now. It is interesting, but I will tell you that when it comes to issues of global health security, the entire world is concerned. And Ebola is one of those diseases of interest to the global community. There is no country across the world. Actually, even for the developed economies, many of them don't have capacity, technical capacity in responding to some of these infectious diseases. So they really get worried so much. And it is their responsibility to mobilize resources, and the U.S. government has mobilized the resources, and we are using these resources well to respond, but mainly in the areas of surveillance and surveillance, laboratory, because the magic of preventing Ebola, the investments, the very initial investment must be much more in looking out for the contacts. All individuals who are close to the very first case are in our custody.
Yeah.
And even those other individuals who are they would be the third tier. They are
That's
all
the 280.
Yes, the 280. So all these, and what happens if you have all these cases is that you must keep most of these high-risk individuals in self-contained rooms. That's why usually the charges go high, because you don't have to mix them up. Once you mix them up, then chances, if one cell converts into a positive case, then also the other person has been in very close contact will end up turning out to be positive.
Okay.
We are not worried in terms of financing or funding for the response. Maybe what we only need members of the public to know is that Ebola is here. The government, through Ministry of Health, working closely with our partners and other government agencies, is managing. The situation is not alarming. And what we need from members of the public is support. The moral support to our healthcare workers, because many of them are actually in quarantine, and also being on alert to ensure that many more leaders who are here and those who are listening to us are able to engage members of the public. Yeah.
Thank you. That's the soothing voice of Dr. Richard Kabanda on both Ebola and Mpox. What's your response this time, speaking even as the government spokesman?
Well, he has spoken well. I wish you had brought Amos.
Wakesa.
He is mad.
I'm on Wakesa's side as well.
Yes.
Amos is mad at us as government, not just health communication when there is an outbreak, but even on security issues. One incident, you remember those days of the famous Fred Enanga and so on. We can just pledge that we shall continue coordinating and improve our communication even when matters are very serious, are deadly, so that we don't create panic, first of all, in our own communities, but also the visiting, investing communities. People are coming here for tourism. Like when I'm in one other forum with the Amos on this strategic communication for government, where we bring key government institutions and the private sector. And we pledge to continue. I think sometimes it is partly out of our communication that we help the naysayers like the Nafukas, the conspiracy theorists, people who don't believe that actually diseases exist in the world. And they just don't question the existence of diseases. You have seen them question the figures we have either on education, on literacy, on life expectancy, on economic growth. Because of the way we communicate, we give them reasons to cast doubt on the data that the government has. Recently, when we had the National Housing and Population Census, we had them a simple mistake, what appears to be a simple mistake, switching the percentage or the figures for the Bagiso, for the one of the above Vandi Mumwe, the Mukasambi days, then it creates a harbano and so on and so forth. So we, the government people, need to communicate better and also contextual, like what the doctor has said here on this radio today. If the Ministry of Health had been contextualizing it that way, first of all, people would be believed, but also we wouldn't create panic. And now, then we would only remain with dealing with the naysayers. Do the naysayers have alternative, credible
naysayers?
Naysayers,
Oh,
naysayers. Yeah.
okay.
I'm speaking in the Padola.
Okay.
Yes, I'm speaking in the Padola.
I've brought you back to Uganda.
Yes. So they wouldn't have, because these naysayers, rarely do they have contrary, credible figures. And what is interesting is that a majority of them say they are educated, but I think they suffer from secondary ignorance. Because if you listen to the people questioning the data, they ought to know, for example, in this particular case of health, that it is unlikely that the government of Uganda alone can declare that there is Ebola in Uganda. I expect a lawyer of good repute, or a lawyer of repute, to know that there are established international protocols on health, that no single country, not just the Ministry of Health of Uganda, can declare that you have Mpox, you have Ebola, you have COVID. No. Now, unless we are questioning those well-established protocols, and of course, in the current circumstances, those protocols or those institutions like WHO are not believable, partly because if you have the most advanced country in the world, you expect their president to know, and he's the one promoting conspiracy theory. He's doubting the origin of COVID or the existence of COVID. He's doubting this, he's doubting that. So it gives ground, because somebody will say, if the president of the United States can cast doubt on the credibility of WHO, who am I to believe WHO? Now, but that onus is really on us, the leaders of our respective countries, to ensure that we communicate better contextually.
Yeah.
But going forward, there are countries that are worse off than Uganda in terms of insecurity, in terms of the infrastructure the government has to deal with different challenges. But those foreign tourists who go there don't. Israel, for example, now is at war for the last 2 or 3 years. But if you ask people to go there, they will go there because they believe that the Israeli government will. America, they shoot people. They shoot people even in the classrooms. But if you tell our average Ugandans here not to go to America, they will say you are mad. American streets are not as safe, probably, as Ugandan streets. The racism. So our people also need to know that part of these cancellations are part of the geopolitical economic dynamics. Because if resources are beginning to flow to Africa, for example, tourism, the Wild West, which is controlling the public narrative, the international public narrative, once the American embassy, even without credible information, issues a negative advisory, all the European countries and embassies in your country will issue a negative advisory. Why? They will not tell you. But really, at the set of it is economic struggle. Why would their resources come to your countries?
Okay.
So, and now your own population does not believe in you for different reasons, maybe governance issues, corruption issues, and so on and so forth. Look at these issues of corruption. Our countries are made to be the most corrupt, perceived to be the most corrupt, where people should not invest. But now you have seen in America, people buy, American businesses buy, Chinese businesses buy policy formulation. But if that had happened in Uganda, they would indict your policy process, they would indict your officials.
The mayor in America who's making prosecutors resign.
Our people need to know that these cancellations are part of the global economic struggles to deny you resources.
Moses.
So that
Thank you. Moses, some of the things.
Give you enough treatment.
Hold on, let's have Moses first. Some of the things, especially OO's conclusion, I disagree with.
Yeah,
if you have,
tell listeners that Nafi today is in a bright yellow.
If you have Moses,
including her hair.
Moses, if you have communicators,
the one here,
if you have communicators like Dr. Kabanda here, then we would have less challenges because he communicates well, he calms you down, tells you how to avoid whatever, tells you the people have been contacted, quarantined. That's the way forward, really.
Sure, because that's how we handled COVID. We have handled other outbreaks. You see, sometime back, I think 2023, I was on a plane with somebody from German. And then I introduced ourselves to each other. Said I'm from Uganda, he's from Germany. He said, "Oh, Uganda, you had 2 years of lockdown." And he was complaining. I know that was so bad. He said, "How many people died in Germany?" I said, what is your population? He said, about 80 million something. I said, how many people died? He said, 160,000, something like that. I said, our population is about half yours. Using the same figures, would have lost about 80,000 people in Uganda. But we lost only 3,600. Now, for us, we rushed. You rushed to open up, and more people died. For us, we were a bit slow. And
3,000
and we lost
about a third of them did not die of COVID.
Fewer people, whatever, but COVID related. So, our approaches through our doctors, our scientists has been very good and has protected lives in Uganda. Yes, somebody might scream, or you are people are not coming because I'm in the tourism sector. But should people just die and we keep quiet? Because if you remember, even in the early 90s, the approach on HIV, Uganda was open. Some other African countries kept quiet, but they realized too late that the incidences were too high just because they thought going public was not good for their economies. On the contrary, the economies suffered more when the cases became too much for them to handle. So I'm not so much worried about the advisories. If you have cases here, let's handle them. And now they should but also remember that part of the reason why they do give those advisories because of their other systems, like insurance. Meaning that if you came to Uganda, or the country which is has some outbreak, and you go to claim insurance, they say, but you were informed. So part of it is not just because they don't want people to come to your country, but their other policies will dictate that if you go knowing that, so that if you fall sick, don't claim insurance. If you die there, don't claim insurance, because we told you. For us, we don't have such insurance schemes. So, but for me, it's better for us to know, people to know, and to do preventive medicine, because preventive care is good. And if people know certain, in fact, for me, like Dr. Kabanda here in Ministry of Health, if they did more on prevention of even other diseases, not the ones which come like Ebola, and start telling you how to prevent. Do you stop you from falling sick of Ebola, including other? How can we prevent malaria? How can we prevent other, like now, lifestyle diseases, the nutrition, and so on and so forth? Uganda could do much, much better than we are doing if the public health system, through the Ministry of Health and through all of us, did perform much better. Now, on the issue of support, yes, the American government is working out a system of trying to reduce what they call wastage expenditure. But the other day, immediately after the executive order was signed, like 2 or 3 days later, the Secretary of State, Mark Rubio, gave exemptions in the areas where support will continue. And one of those was the support to life-saving medications, and testing. So on Wednesday, I had occasion to talk to the American ambassador to Uganda, His Excellency William Pope, and I inquired from him how that affects Uganda, and he assured that, I think he has also assured the Ministry of Health that areas of support, like in ARVs, in medicines, basically, ARVs and malaria support and so forth, where it is medicines and the testing of people like laboratories, what have been doing. Like those people who have when ARVs, they check their viral loads and so forth. Those ones will continue, are not affected. It is other areas of, say, maybe if they are paying salaries for some people, those will stop. But the medicines and the testings will continue. That is the assurance I got from the ambassador. So we shouldn't be worried in that line. Yeah.
Malcolm, you're the American you are not on this panel. You are the American. So I guess your visas have been cancelled now. You can't go.
I might be able to foreign agent. And my movements scrutinized.
Yeah.
I would like to agree with Moses that there are other reasons that the governments decide to issue advisories choose to do so. I thought O's opinion was fairly reduction is free. So it comes down to economic policy, internal economic policy. I think that when you listen to what you referred to as the soothing voice of Commissioner Kabanda, I am greatly encouraged because with the 8th iteration of Ebola, you would expect greater experience, greater ability to respond. However, I think that has been challenging. We are far beyond the days when every government release needed or to sign off. Almost every entity has a spokesperson. The media is crying that their best are being pulled into these positions. And so to be able to manage the communication from the Ministry of Health, I think is priority number one. And that, in turn, also would affect how these embassies and the international response towards the outbreak. We handled, I think, quite well over COVID. There were accolades that were going around for the minister and her staff. But I think this one could have been done differently. You had updates that were coming through, a certain building of confidence. Because I don't think that in holding the information, you are actually building confidence. You are promoting the conspiracy theories that people are going to start peddling. But when you come out clearly, acknowledge the outbreak, the cases, what is being done, the way you are speaking, if that information is summarized into a poster and a graphic and sent on X or circulated in WhatsApp groups, next thing you know, we are hailing the Ministry of Health for doing a wonderful job. But if that information remains internal, then we will struggle. I am a little concerned, though, and I think also...
it wasn't internal. It was, I agreed with the first part of
submission, yes.
The last submission. But it is, Moses Biaruhanga, for him, is guaranteed a salary and everything. He likes those reckless shouting because, as you said, he says, if there's an Ebola, we have practiced, we have done it, we closed the country 2 years, and there was nothing wrong. Did you die? So that's how business dies.
Yes.
Schools closed. He just says, did you die? So he's the one really we need to challenge. He's
we had to protect lives first. Protect lives. Because I'm happy that now I'm here with Nafuka. We don't agree each other politically, but she didn't die of COVID.
No, but I think that it can't just be a protection of lives, and I think that the response must be measured in a way that yes, it protects lives, but it also protects the quality of life after.
Yeah.
And especially at an early stage like this, where the case of death is one. You, from what the commissioner has said, there is a clear management of the contacts, and the response is a good one. But that information needs to be churned out. I remember reading a story where the minister, I think it was the minister or the spokesperson, said, we don't have any more updates for you. We'll be sharing as and when, if we have had outbreaks before, if we have had lockdowns because of Ebola before, certainly there were lockdowns, particular districts that were, I think, about 15 that were locked down. But that brings a certain level of angst within the population. And I think it is your responsibility as government to be able to come out and communicate and articulate these things very well, so that there is a sense of confidence. Or talks about how there is no confidence in the government. Those are some of the challenges. If the communication is not done well enough to build the confidence, then there's not going to be confidence from the population. There's going to be conspiracy theories. When there's some chest thumping that happens, and probably moving on to the USAID funding, when there's some chest thumping that happens from the Secretary of Treasury that these cuts we are expecting, we're not going to be, there's going to be zero impact. I think that's you can ask yourself who is fooling whom, because there is no way that in as much as there might have been an expectation of some level of reduced funding, I don't think we expected a freeze. And I don't think that the government has the ability, despite the fact that it has been going around talking about how, they are the ones who are saving every life here and there. This exposes how naked the emperor is. That actually, when the funding from the US government stops, then all HIV clinics close. That if there is a correlation like that, then there's certainly a challenge. When the US funding, US government funding stops, then there's 2,000 health workers who are being laid off. Those correlations certainly have to be the implications from them must be taken into account. I'll just say this, Oscar. Slightly back to the Ebola bit. I think I was a bit surprised. And maybe in agreeing with Moses again, at the issues around prevention.
You keep agreeing with him.
When a health worker, that male nurse that sadly has passed away, is the one who contracts Ebola, and after seeking medical attention in 2 hospitals, decides to go to a traditional healer. I do not want to say that traditional healers don't have a place in our broader medical response.
You don't want to find Dr. Kabanda there.
But I struggle when the male nurse is the one who is doing this. So the question is, how much in terms of prevention, in terms of health promotion, do we do?
You're contradicting yourself. On one hand, you're saying the traditional healers can do something.
I didn't say they. I just don't want to.
And Africans generally.
Yes.
We are a dual society.
People go to church and go there.
Speak for yourself.
Even those of you who have Christian names,
They find themselves there.
No, and let us, Oscar. I think let's not make this an argument of their relevance. I said yes. I don't want to say they have no relevance at all. But that after failing to access, after going twice to 2 different hospitals, then they go to a traditional healer. What do you expect of that average Ugandan who contracts Ebola? So when we become very defensive, then we don't even see the actual point. How much more do we need to do to ensure that the average Ugandan understands that symptom A, B, and C means I should not even go to the health center. I should quarantine myself and request for an ambulance to come and have me checked up.
Thank you. Namfi.
Oscar, Namaganda, where?
You need a microphone.
Didn't one of those traditional doctors doesn't he have monkeypox?
Namfi,
One of the witch doctors.
Concentrate on the update given to us by Dr. Kabanda.
Oscar.
And Wekesa's points on that.
Yes.
Maybe they were alarmist.
Oscar, we can't be enemies of our own selves. Wekesa makes a valid point. And I know Moses and Oo will come here and tell us that every country has a duty, international laws, they are responsible to do. We all know no one sticks. Ask China. You think China is telling you about its outbreaks of all manner of diseases that they are getting from monkeys and bats? They are not. When did they tell us about COVID? You think they told you on day one when they knew about COVID? No country is telling you. When I lived in the UK, there was so much violence in London. Do you see it on BBC every day? They will have you know that London is the leading financial capital of the world. It is the one that is to come and see the Gherkin, come and see the River Thames, come and see this and that and that and that. But do you know how dirty their underground is? Remember when the news broke of the bed bugs in New York and rats in the underground? Do you know how much they suffered with their tourism? Are they still telling those stories? You think the bed bugs went away? You know bed bugs, they never go away. You know, you remember the bed bugs in Paris? You remember what happened to their tourism industry when they started telling us? You think they went away? The subsequent outbreaks, you think they're telling you about them? Yes, there may be international standards, but you have to be kind to yourself. You can't be the poor man who is also stupid. Choose your struggle, you know? So for me, Oscar, we have to be very careful when we are doing these things, and when a leading figure in the industry, in the tourism industry, comes out and tells you that these kind of the way we handle this, he's not telling you do not be deceitful. There is a reason why there are PROs and spin doctors in Hollywood and in the US. Trump has come into power, and now we know how much lies underneath the belly of the US administration. They were there, and for a long time, they held it afloat. But at the end of the day, he's not even telling you the half of it. Because no one comes and talks about the boil that is hidden under there because on your first date. Because no one will take you when you go to speaking about all your negatives. So yes, we need to manage the diseases. But how do we go about it? Because when Wekesa tells you, the moment you say we have an Ebola outbreak, I get 1,000 cancellations. Then you have to sit back and then work with that sector. You move to ask stakeholders, then how do you propose we do it? Go to other countries, see how they do it. We have neighboring Kenya here. You think they don't get these outbreaks? But do they handle it the way we handle it? No, we can't. We can't just be people who stick their heads in the sand and pretend that nothing is going on, and then we affect all sectors, and then you start saying everybody is broke. The economy is doing badly, and yet every day we come and hammer one sector in the same way without taking responsibility for our actions and say we are right. You may be right, but it doesn't make sense if you're dead right. You may say we are preventing death from Ebola, but if then people die from death from poverty, then you're not helping the society anyway. So we have to have a balance, because no one is telling you everything. Look at China, and trust me, it's not telling you about their outbreaks every day.
Malcolm, I have a concern. You know, when Namfi has been speaking, then Mukasambi Day is next.
So interjecting with Malcolm.
So, Honorable Mukasambi Day, welcome to Gang. You came in a bit later. I hope you caught what Dr. Kabanda was saying as you drove in.
Yes.
I took him to task, and he told me since school he's been like that, so now I've allowed him.
Go on.
Yes. Of course, I had his submission. You know, I love Capital Gang because it is a place where there is completely intellectual discourse, as opposed to many shows where you would find almost persons akin to catechists trying to parrot opinion is like a popinjay. But here, this is intellectual discourse. I heard Mr. Kabanda properly, particularly adumerating on matters of Mpox and Ebola. Mpox.
You don't know, you don't care.
You know, Oscar, you need to protect me because
your microphone is on.
Because Mr. Kabanda cited for purposes of mpox, I think it is sexual intercourse. Now, of course, that now brings forward a very big problem. Because yesterday was Valentine's Day. I can't. I don't know how much work you are now headed for. Otherwise, you may find that the biggest population of Ugandans now contracted mpox. Now, if you are going to be public about that, there is going to be a problem. I saw traffic jam everywhere yesterday, everybody donning red and what. So whoever has a photograph of a red attire, please go and check for mpox. Otherwise, there's going to be a problem.
No, people of my age.
You need to say that very loud. So that we can hear.
So I would want the health officials to be more loud on control measures than highlighting the spread and the transmission. Because Uganda is not just the only country with it. Several countries, of course, have been cited to have had the scourge. Sierra Leone, Burundi, Kenya. But you see, Uganda is now restricting it to our own territory in such a way that obviously it is becoming a turn-off for the tourism industry. And that is why I support also the views expressed in favor of our
moderation.
Yes. We have always had problems controlling, particularly because most countries like Sierra Leone is getting a template of its own management of the COVID-19, how it did it. In Uganda, you see, when you locate the source, it is very easy for you to begin the management process of such a problem. In Uganda, the source had been located to be, particularly the source for COVID-19, it had been identified predominantly as the transporters, using routes that are known, and obviously with destinations that are also known. Now, the management process would have been, other than, of course, the stealthy and hurried determination to lock down the whole country, it would have been to majorly zone the control processes. For example, we would have the entries of Malaba and Busia. We would be in position to zone because we ended up trying to control the COVID-19 for all countries that are using our route, that are using Malaba and Busia as transportation routes now to their own destinations. We started now testing for South Sudan, testing for DRC, testing for Rwanda, testing for, and we did not have the capacity to do so. No, we failed to have the capacity. That's why we locked down the country. If we had tested properly all the entry points to Uganda, we would never lock out our country. And once we failed to do so, obviously we locked ourselves up for almost 2 years, becoming almost the longest lockdowns one of the longest lockdowns in addition to Buenos Aires and in the whole world. So we started hiding from the virus.
We started hiding from
we started hiding and taking cover. And in my opinion, that is not control. You see, yes, hiding, taking cover, dodging, that is not control.
Yeah.
Control would have meant proceeding unconcernedly while, of course, the departments are doing their works. Now, for COVID-19, for Ebola, I would have expected the ministry to begin telling us the randomized vaccinations that are beginning and commencing, assisted by World Health Organization and CEPA, highlighting the presence of a problem that actually everybody is aware is present elsewhere, but not being highlighted the same way Uganda is doing, is to me making it a very big problem when it actually isn't. Finally, you see, and my colleagues are raising something to do with the hurried publication and publicizing of material. You remember when the department of the new notorious department headed by Elon Musk of the U.S. Department of Government Efficiency,
Dog.
Looked at details and documentations of USAID, and he discovered that close to $50 million worth of condoms were sent to Gaza. He quickly rushed to his ex-handle, saying, we sponsored Gaza condoms, until he was actually tapped and told afterwards that actually this is Gaza Empire of Mozambique. And now, I am sure he's nursing some wounds. So
Let's stop for a quick break.
The Capital Gang on 91.3 Capital FM.
Attention farmers and agripreneurs. Uganda's biggest agriculture event is here. The Harvest Money Expo 2025 from February 14th to 16th, 2025. Come to the Nambola Stadium and discover the latest farming innovations, attend expert training sessions, unlock financing opportunities, and so much more. Whether you're growing your agribusiness or just starting out, this is the event you can't afford to miss. Interest is only 10,000 shillings daily and 20,000 shillings daily with training. Gets open from 8 a.m. to 6 p.m. Mark your calendar and let's grow together at the Harvest Money Expo. The Harvest Money Expo is brought to you by New Vision and sponsored by the Netherlands Embassy, Engineering Solutions, Tunga Nutrition, Uganda Development Corporation, and Bella Wine.
Are you set for a good life? We are here with you to make your life better. Achieve goals soon as Equity Bank. We're setting Equifuga. We're setting agribusiness. Equizimba.
Be an achiever this season. Apply for a personal or business loan from any of our branches or call 0312-327-000 for more information. Ready, get set, and go. Equity, your listening, caring partner. Equity Bank Uganda Limited is regulated by the Bank of Uganda. Customer deposits of up to 10 million shillings are protected by the Deposit Protection Fund. Terms and conditions apply.
The Capital Gang on 91.3 Capital FM.
Welcome back from the break. This is the Capital Gang. We have Ministry of Health, Dr. Richard Kavanda, Commissioner, Health Services, in charge of health promotion and education. You've listened intently, Dr. Kavanda, to all comments around the table. The most significant is you are alarming and the ministry could be better. Will you take that message back?
Mm-hmm.
I have had...
Actually, not alarmist is the word I wanted to use.
I have had the comments from my colleagues here. And I don't blame them because of those comments, because somehow I understand where they are coming from. Uganda is one of the few countries that has been unprivileged. We are prone to epidemics because of our locality. And of course, you know, most of our epidemics have been originating from the eastern part of our neighboring country, this side, DRC. It has been a very big problem. And one of the reasons why I would say that we have an epidemic fatigue in the country. Before we got Ebola, before we got COVID-19 in 2020, we are in Ebola preparedness. And after COVID-19, we had Marburg, we had anthrax, so we had Mpox, so now we have Ebola. So there is an outbreak or an epidemic fatigue. And so I can try to understand that. And I've had an opportunity to visit many countries on the continent. I happen to be the chair of one of the technical committees for community health systems on the continent, for Africa CDC. I'm also a member of the Global World Health Organization the expert group that advises World Health Organization globally on well-being and health promotion. So at least I'm privy to a lot of information.
Computer should be privileged to be near you.
Actually, the panelists here have all the reasons to believe and know that we are providing information out of experience. But the epidemic fatigue has a lot of negative effect on the way we look at things, the way we think, and the way we respond as citizens, live around the health sector. So we can understand what our colleagues are saying. But it is also completely wrong for my sister to compare countries that have had an epidemic of birds and all that to Ebola. Actually, there is no country that has ever had Ebola and kept quiet. Ebola is not a joke. It's not a joke. You cannot compare it. You can.
Outbreak of Ebola. How long did it take for them to announce that they actually have Ebola? You remember in 2014?
You can only take long if you have not yet confirmed that really you have the disease. All countries that have confirmed that they have Ebola, the regulation says that you must be able to announce within 24 hours. And for us,
it's an international standard?
It's an international standard. Within 24 hours, you must be able to...
International standard applying to poor countries mainly.
Thank you.
Not
because in 2014,
No.
Very well, because I was traveling to the US at that time.
How many countries have you visited that have had Ebola outbreaks?
The US.
How many countries? The question is how many countries?
All I know is that when there was the patient in Dallas in the US in 2014, it took them over a month to even admit that Ebola patient.
So how did you get to know? You see.
I knew afterwards when the news said that it took them a month.
I'll give you an example. We are saying that the outbreak in the country here was declared on 30th of January. From our records and from the assessment, it is possible that the index case had this virus maybe 20 days back, or even
because it takes 21 days.
Yeah. So if you talk of a month, you're actually looking at the incubation period, and the incubation.
24 hours counts from when? From when you know.
When you
America knew and confirmed. And still refused to tell the world.
You see nothing. Now you made the point.
I'm not privy to that information, because I don't base on.
I'm going to ask Uncle Google.
I guess I don't base on unverified information for me to make my submissions.
Yes.
Yeah, my submissions. But what I know is that internationally, if you confirm Ebola, you are supposed to announce within 24 hours. And there are also consequences of keeping quiet, because if you keep quiet and you don't let the public know that you have the disease, you actually put the population at risk of getting this. And actually, government would be blamed. If, for example, had kept quiet and many people, if, for example, she had lost a relative, she would be saying that government kept quiet. Government did not come out openly. It is our responsibility to come out openly, to let you know what's happening in the country. It is also our responsibility to assure you, just like I've assured you, that government is in charge, government is in control, and there is nothing to worry about.
Yeah.
And lastly, it is also not fair for our colleagues to compare unserious challenges that have happened in other countries to serious challenges like Ebola. Otherwise, to the elite like you, you'll be misleading our people in rural communities who would end up getting the virus. We have heard the outcries of our colleagues who are in the business community. We have had the high-level engagement with them, actually, the Minister of Health. We've had a high-level engagement with our colleagues from the tourism industry, from the private sector, for them to be able to understand where we are coming from and what we are doing about it. And it is also not possible, I'll tell you, one of the things why they were condemning us is that why don't we communicate in the local language the way Rwanda does and Tanzania? You compare Tanzania that people are able to hear Swahili in the entire country, and Rwanda they are able to
understand
and speak. Yeah,
and
write. The same to Rwanda, but you're in a country where one local language cannot be able, is not good enough to communicate to the entire country. So people need to contextualize.
We actually sing our national language in English.
So we must contextualize. And lastly, one of the reasons, as my brother was saying, one of the reasons why I am here is to be able to provide facts, to let you know what the government is doing, the interventions that we are implementing, for you to be able to appreciate that something is being done.
Angelo, who is also one of our regulars, sent a message that says, the problem is that healthcare has been part of a political project and a key aspect of foreign policy and relationship between Uganda and donors. Tourism, on the other hand, is private sector and occasionally used to market the country's natural endowments. So it is less important than diseases in transacting Uganda's political ties, especially with the West. So you, government, as I put to Moses, and I've done that regularly, as a government person, his salary is guaranteed. He does not know any poverty level. So he will be supporting you to make alarmist announcements that affect the rest of us to wallow in die of poverty, as Namfuka has been pointing out. Are you aware of that attitude you government people have in just coming out and say there's Ebola? On the consequences.
You see,
We shouldn't talk about it.
okay, let me and
Talk about it the way he has talked today.
and let me tell you, yes.
As Malcolm had said, if you had a poster in the manner you spoke today, we'd all be very okay.
You see, my neighbors here.
Is here.
Kabanda has
Kabanda is here.
superiors who supervise him, and if they are obstinate, he has very little to do. Maybe, maybe Oscar, you should have invited his ultimate supervisor who determines how messages go out.
The supervisor sent Kabanda, so we must hang Kabanda.
I should also let you know that officially I sign off all communications for the sector. Officially, I must approve all communications for the sector.
So technically, we are telling you to improve your
I should also let you know that I don't control what people
speak.
What people may speak recklessly, but I'm not saying that the announcements that come, especially for the outbreaks, there is a process. There's a process that we go through before we announce. You cannot announce an outbreak without clearance from the head of state. You cannot announce an outbreak without engaging other MDAs and looking at the consequences of that kind of pronouncement. So that's what people need to know. Okay. But I just wanted to conclusion. My neighbors here are comparing a Primo to
a Mercedes.
To a Mercedes. It was Kazka, okay.
Me, I came on foot.
Whereas malaria kills so many people daily. But the impact of an infectious disease, for example, like Ebola, can be very, very serious economically, physically, and mentally to our lives. So let people not compare Ebola to any other disease that we are grappling with as a country.
I agree with you.
Yeah.
So thank you very much, Dr. Richard Kabanda, with your soothing tone. We would like the ministry to continue like that. Dr. Kabanda is Commissioner Health Services in charge of health promotion and education at the Ministry of Health. Thank you so much.
You haven't asked what we are doing about
so Moses, we go to another one.
Before we go to that one.
No, we have gone to it.
Sure.
So Moses, you are.
I wanted to.
Moses, you
I
are.
wanted to tell.
Hold on. You are you fit everything in one. You're the champion of PDM, and I have put to you, as I have put to you severally, PDM is also another project that has not been communicated well. So this morning I organized a show where you can improve the communication of PDM. When we first talked about it here, Abdul was saying that money is just going to be chewed. People will grab it and chew it and not do startup businesses as you wished. So let's start it at the beginning. It's a good thing that government is giving out startup money. But number one, what is PDM and what informed PDM?
Well, PDM in full is the parish development model. It has 7 pillars, but the one now being implemented mainly is the financial inclusion. That is the...
But it's okay, let's go through the 7. Number 1, there's no harm in.
No, that's for Fonopondo. I want to concentrate
on money.
I want to concentrate on financial inclusion. The other, the 6, I don't want to go into them now.
Fair enough.
But on financial inclusion, what informed it? Well, the whole idea has been, how do we bring all Ugandans in the money sector, in the financial sector? Some figures were showing in the past that about 68% of Ugandans were in subsistence economy, as far as maybe about 10 years ago. Recent figures show that only 33% of Ugandans are in the subsistence economy, while the rest are in the money economy. Now, the idea of the NRM government has been, how do we bring all those Ugandans, the 33%, in the money economy? And 33%, in terms of household, would be about 3.5 million households in Uganda who are not in the money economy. So the PDM, the financial inclusion part of PDM, is aimed at those. How do we assist them, bring them in the economy? We had done other programs earlier through Operation Wealth Creation, through giving coffee seedlings to farmers, through giving other forms of seedlings and planting materials to farmers, and the response has been good. So the PDM, there were criticisms how those programs were being implemented. How do you select the beneficiaries? How much do you give them, and so forth? So the PDM was, let's create a circle at the parish level, put in money. The members, the beneficiaries select their own leaders. Those leaders select who will benefit first among themselves. So democratize it. Because they were saying, when it is the government people coming to select who benefits, they select their relatives and so forth, whom they give to themselves. That we said, okay, you be responsible for your own selection. So that from now, our role as government is to bring the money, you select who benefits and so forth. So we have now 10,800, let me give you the correct figure, 10,589 parishes in Uganda. Each parish, each year, getting 100 million shillings. The members in that parish who would fall in the 33%, meaning those who are not in the money economy. Me and the Fonopondo are not in our parishes, we don't fall in that category. And my sister Namfuka. But those who fall in that category are supposed to be the beneficiaries. We have had some cases of people who not fall in the category getting the money, but those are not the majority, but the intention is those. Now, in the last 2 financial years, government has so far spent 2.1 trillion of sending money to the parishes to benefit those people in subsistence economy, to get them out of poverty. At first, when it was started around 22-23, the idea was the maximum you could borrow was 1 million. But later, within 2023, Cabinet took a decision and said, no, borrow or give? Borrow. It's borrowing. Let everybody who wants to borrow, it should be 1 million. Because if you're saying you can take 500,000, 800,000 was confusing. Said everybody should be taking 1 million wants to borrow. So since then, it's 1 million. So we have so far reached out to over 2 million households in the whole country. And the program is continuing. For instance, in this financial year, the money for the 24-25 financial year has just been released. It is just in the process of being dispersed. But the money for the previous 2 financial years is already within the population, and we are seeing progress in these sectors. The beneficiaries, when you talk to some of them, somebody will tell you, I remember in 2023, around April, I went to Luwero. We met the PDM beneficiaries from Luwero sub-county. At that time, there were about 1,200 beneficiaries. And one person came and said, I bought 1 million, I engaged in piggery, I did ABCD, and now I have 5 million on me. The payment, we gave them 2 years grace period. So like those who borrowed in 2023, they start paying now 2025. And the payment is, the interest is 6% on that loan.
You pay who?
They pay back to their circle.
Okay.
The money doesn't come back to government. It is a revolving fund within their circle. So when they get 100 million and 100 million, like people who borrowed 100 million in 2023, if they start paying back in 2025, 2 years later, that money would stay in that parish, and they will be lending out to new borrowers within the parish. So you would expect that maybe within, say, 5 years, where government has put in like 500 million in the parish would have like 800 million from after when the first beneficiaries have already paid back. Those who are able to pay back. So if you want to see part of the progress, today Ofono Pondo will tell you he's doing coffee, but I've been hearing from other people doing coffee saying that there is scarcity of coffee seedlings. Reason? Most of the PDM borrowers who are engaged in coffee planting and have bought the seedlings. In fact, the other day I was talking to one of my staff from Nebi. He's doing cassava farming. He's doing cassava. He was saying, in most of Nebi, people have grown cassava. Now the challenge now is the market for cassava. So in fact, the price of cassava has come down. It's a good challenge to me, as far as I'm concerned. It's a good challenge in a way that people have engaged in cassava growing. There's a factory in Nwoya which processes cassava into ethanol and sells it to Kenya. So the idea was, does this factory have enough capacity to process most of cassava growing in that area? There's another cassava factory being set up in Kitgum through the Catholic Church, working with the government, also to produce ethanol from cassava. So all those are showing you that the response has been good, and I'm happy we are continuing. Okay. The president is now touring the country, meeting some of the PDM beneficiaries in every region he has been to. Of recent, starting around October, he was in Bukedi. He has been to Bukedi, has been to Teso, he has been to Karamoja, he has been to Sebei, he has been to Bugisu, he has been to Lango, he's now in Kigezi. Today he's completing Kigezi.
Bide will say he's been campaigning all over. But Honorable Mukasa Mbide, yes. Have you met with successful, these success stories Moses is giving us? Have you seen those success stories in Masaka?
They can't see success stories because he has no car to travel. His engine has been taken away.
Are they there in Masaka?
I would like to enjoy your protection.
Yes. Let me switch off his microphone.
Yes. First of all, I have got a problem with I don't know whether the president is doing monitoring and evaluation of the PDM, because then my question would be how he arrives at the sampling procedure as a president. How he samples.
Yeah, because who gets to speak to President Museveni?
Because it becomes a logical impossibility. His veracity is tested, and probably towards an election, he becomes a challenge to the performance of that program, because he's a candidate in waiting, and he goes around having, of course, using his own systems to sample persons that would be, in effect, presented as success stories for the PDM program. In my opinion, of course, you remember when we were growing up, I think we were introduced to what they used to call the Pavlovian theory. Pavlov is, I think he was a Russian, who established an experiment, at least now for the benefit of the listeners. And in this experiment, he was trying to arrive at the possibility of conditioning nature. How you can condition in nature in such a way that it begins making substantial, similar responses to similar conditions of life. So he got dogs, and at every 4 p.m. of the day, he would give those dogs, he would ring a bell and feed them. So every 4 p.m. would ring a bell and feed them. Now the experiment was, at every 4 p.m., dogs would start salivating. To the extent that now, at 4 p.m., once a bell rang and there was no food, still dogs started salivating. Now, each and every period towards an election, there is a salivation process that goes on throughout the country of persons waiting to receive monies, and a substantive candidate who is the incumbent also now moving all over the country. He has been directed to where he goes because the procedure for sampling is also unknown. But it is also impossible that you can run an economic program which is single and one, and that you can, pursuant to that program, obtain results that have the effect of
So, in short, in Masaka,
what do I want?
Yes. Are there any success stories?
You see, if you want to fight
stories,
if you want to fight poverty using a model, you must first of all find the model in which or through which poverty attacked the population, the population you are targeting. What do I mean?
Moses says that they were not in the money economy. That is the problem.
So there is a model that poverty used in order to delink them from the money economy. The first model I would tell you is, traditionally we know that, for example, women never used to work. They were usually domestic persons. Now there is a poverty model that is gender related. It is historical, it is traditional. Now you have to emerge with a model that answers that delinking from the... Now there is another model. You are a student from primary school up to around university. Those are around 14, 15 years, almost doing nothing, no income. Now there is a model that is education related, that poverty used to definitely now, of course, attack that kind of population. Now if you want to solve the delinking of such persons from the money economy, you again develop a model. What I mean is that it must be a multiplicity of models, not one single model that can solve. You cannot use one model. And you even begin to test it using the whole president of a country to test the results of one single model. No, it is impossible. Even when you look at the World Bank reports, it must be a multiplicity, and they are field tested. They cannot be tested by a head of state who moves with a convoy, directed, and samples are brought forward. He questions and answers, goes to a plantation, cuts down one banana plant. In my opinion, that cannot be a monitoring and evaluation procedure. Okay. Maybe it's a campaign.
You may be right, because no one will take NAFCA to see the president. So let's stop for a quick break.
The Capital Gang on 91.3 Capital FM.
Previously in the back to school film for parents, the person with my money is waiting for some money from a person who is also waiting for some money from a person with the money. Quick gamba, stress just. Sala stress with DFCU loans this back to school. Get sorted with some money up to 250 million shillings in 24 hours, or an express mobile loan of up to 2 million shillings at competitive interest rates and cover school fees, requirements or any other personal needs. Call 0800 203 206 or visit DFCU's social media pages for details. DFCU, going further together. DFCU Bank is regulated by Bank of Uganda. Customer deposits are protected by the Deposit Protection Fund of Uganda. Up to 10 million shillings. Terms and conditions apply.
The Capital Gang on 91.3 Capital FM.
Welcome back from the break. This is the Capital Gang. You have a sentence before you go to Namfka. Very quickly.
OO has actually told me to pose questions. I should ask, how did they arrive at? Because please channel the question is because for me I brought out
I thought as an intellectual you should have first of all you should have pleaded that probably you don't know.
Okay, my question is my question is
for that matter is using.
My question is
and then Moses or I
which statistics is the president developing out of that monitoring and for whose benefit?
A partial report is using.
Let us go to...
And for whose benefit?
Okay.
Because I thought statistics had to be developed for government to...
Well, they said that there are about 3.5 million people that they wish to bring into the money economy.
3.5 million households.
Households.
Yeah.
Oscar. I think Moses...
There's Matt Muno on Twitter. On X formerly, it says, good morning, gang. Please ask Moses how much money the president spends on the tours of PDM projects as opposed to the money sent to the parishes. So there's that as well.
It could be like you said, the money that reaches the people versus the money that administers the aid.
You see, every year we are putting 1 trillion.
And I'm saying that 1 trillion could be put to better use, even if it's just tax holidays for the normal taxpayers.
Before you say that one, Nafi.
And another 1 trillion to tour.
No.
Or 3 trillion.
Nafi,
Oscar.
before you go, my question to you first was, do you have any examples of success stories in Nyenga?
No.
Is it because
and
you have not
I keep asking? No, I ask because you know Oscar Manozi person.
In the last 1 year,
I have relatives who have got that PDM money.
Let me switch off Moses' microphone.
Yes, protect me from Moses. And these people, Oscar, you have relatives. Do you know any of your relatives? We outside the money economy, who you can give 1 million and they prosper, and in 1 year they have 5. Do you know one like this? You see, these people see us with ears and think we are goats. They see hair on our heads and think we are sheep. We are better than that, Moses. This money, Oscar, from the beginning, was designed to reward NRM cadres.
Let me look.
Now the president is going around. Why do you think he's supervising it himself with his sidekick here? This is his Elon Musk. He's supervising it. Now he's going around reminding people, remember the money I gave you? Voting is next year.
At 10:30 this morning, it says, OSM, why don't you give Namfi a medal in insulting?
No, I don't insult.
Okay.
Oscar, I'm a mother these days. Yes. So, Oscar, I was telling you, we came here 3 years ago and told you this money is for rewarding NRM cadres who are at the neck of the president asking, where is our money for the campaigns? And of course, president didn't have anywhere to get from this money because he had, finished all the one he had looted. So what does NRM do? Concoct this scheme, and I know Ramadan Gobi knows wherever he is. It was never designed to get anyone outside the money economy, because even the people I know personally who have been given this money, they're not outside the money economy. But one thing I know, they're NRM cadres. And that is why you see at the district, the LC2 chairperson has to be there. The NRM person has to be there when they're disbursing the money. Now, why is the president moving around to supervise, air quotes, this whole disbursement and how the money has gone? Because he needs to remind the people, remember who gave you this money, remember who you need to vote for come January 2026. He's trying to draw a link between himself and this money. Don't even think that there is any other reason why he's going around. You think he's interested in anyone in Uganda being rich? He is old school political economy where rich people are not governable. So he will do everything in his power. Why would he, in a one breath, sabotage coffee that is doing well, and in another breath try to lift up the lives of Ugandans? The same person. Why would he, who has presided over Bonaba Gaggawale, NADS, and all these other projects, which harebrained concoctions, which have never worked, which don't have a report, which have never been examined why they failed, he's never bothered, and now he has a new one, and you think it's designed to work? No. It is not. And no one buys it. But go ahead, because you've already done so much. Who is stopping you from doing more until, we get new leadership, which is more interested in the welfare of the people?
Now that Nafi
and not clinging onto power.
With her rant, over to you.
It's not a rant, it's a submission.
Same question.
Oscar was tempted to give her my minutes.
No.
But...
Let's start.
I thought we glossed over, Oscar, the 7 pillars of the parish development model, because when Moses attempts to reduce the entire parish development model to the financial inclusion pillar, then he paints a rosy picture, but therein is cementing the problem, because if we are being honest about it, the financial inclusion model should have been the very last model that was being presented. Like Nafi says, 3 years ago, we were all here. Many, I think, at least the 5 of us, were here, and we discussed this PDM and predicted catastrophe. I remember the very first, exactly, Auditor General's report. Actually, all the reports that have come out on PDM, the public reports have been negative until the president decides to do a tour. That's what they are calling it. I remember we discussed people receiving this money and going and marrying second wives, and OO said that's okay. So I'm wondering, how does a second wife get you into the money economy?
Maybe she's hardworking and
maybe, but highly unlikely. Pillar number 1 is agriculture value chain development. Now we are talking about, and Moses mentions cassava that is now unsellable. The people who won't even be able to pay back their loans because the price of cassava has gone down. The market is saturated. Why? Because there was no discussion of pillar number 1 on value chain development. How do we how do we increase the factories? How do we store this cassava? How do we manage it so that it actually can get out of the money economy? Pillar number 2, infrastructure and economic services. I'm sure there are stories to tell there. Pillar number 3 is financial inclusion. Pillar number 4, social services. Pillar number 5, community mobilization and mindset change. Now, if you want to get out of money economy, which they have been out of where they are into a money economy, a place they have been for several years, I think that you begin with a mindset change.
Where their ancestors have been.
You begin with them realizing that they shouldn't be where they are. I assume that's what the mindset change is about. How do we desire to be a part of what is going on there, as opposed to sitting down and being apolitical and apathetic to what is going on in the country? So the emphasis has been on financial inclusion, or pillar number 6 is parish-based management information system, and pillar number 7, governance and administration. Now, all of those have been relegated to the back seat, and only financial inclusion at the front, and it becomes a little clear as to why. It is also difficult to understand why a government that has been very, very keen on has been very keen on stopping groups to self-organize, is now very keen on organizing the groups themselves. There are several groups that have been. There's been a lot of work, whether it is from the POMA or even the work by the NGO Bureau. All of these have been geared towards preventing civil society from self-organizing. That is a fact, without necessarily having government intervention. So when you have the government being the one that comes and says, you organize a circle there, and when you organize, you report to us. So that level of monitoring over the self-organizing is what I find quite intriguing, because in that self-organizing, you are able to monitor who. Okay. Yeah, you're able to monitor who is doing what, where, and maybe contribute to this parish-based management information system. So I think that I am encouraged to lend myself to the argument that this is a political gimmick more than anything else. There might be 1, 2, 3 success stories. When the president is in Namutumba and seeing a husband and wife who are all benefiting from in the same family, all benefiting from PDM, and they are being and actually while they're appreciating, they're asking. So now we have this problem. We are unable to get our goods to the market. But if there was a more comprehensive approach, look at the things that are supposed, because that's the government's role, provide an enabling environment. If the environment is enabling, then you watch the citizens participate.
You wanted
on their
just
own.
1 minute.
Oscar, look at what Rwanda has done with its, for example, with its traders and community, and the kind of assistance governments give them. That is the kind of assistance where someone says, I'll pay tax at the end of this because government is interfering to actively listen to me, identify where the loopholes are, and sort them out. Imagine if this 1 trillion went to even just buying machinery for farmers and building silos. You remember back in 2017 when farmers produced a lot of maize and it was at 200 shillings per kilo, and we appealed to government to come in and help. Since then, farmers have been cynical about farming because of this kind of thing. Now imagine if government put that money towards buying from the farmers whatever is excess, releasing them whenever there is some kind of famine, and then having silos to keep this kind of, that is a much
Tanzania
better
did
program than this.
With nuts. Okay, now we cross over to Opondo. There's a Tumusime who says, good morning, gang. Which type of economists are these? The president is using $1 billion to supervise 1 million of PDM in the village. They don't present the real poor PDM beneficiaries. They just present rich PDM, and that won't solve anything. That's an opinion on X, formerly Twitter.
The debate is, there's a gentleman called Gala. Gala used to be the minister for Luwero. Galabuzi, my young brother, is the one heading the PDM Secretariat, housed under the Ministry of Local Government. I suggest, this being a big issue, you invite him so that we dedicate the 2 hours to discuss.
He'd be better than Moses?
I'm saying he's the one heading the Secretariat.
Okay.
You can, Moses can join him, but there are success stories scattered, probably not very big steps, but they are success stories. The challenges, in my view, appear to outweigh the successes so far, but if we keep there consistently, I think we can turn the tables and we shall be writing more success stories. Oscar, I travel around the country, as you know. In the last 1 month alone, I have been to Kigezi, I have been to West Nile, I've been to Acholi, I've been to Teso, and they are success stories. We can't enumerate them here. Now, Pamizo did read out the 7 pillars. All the 7 pillars are actually under implementation. However, there are people who have chosen to overemphasize all the financial inclusion, and for good measure probably, because when I receive 1 million, if I'm poor, I've never held $1 million at all, I will sing with it. And I think, so if you get the 1 million, but you have not dealt with, you as an individual, the recipient, you are not focusing on mindset change. Certainly the 1 million may not help you. And sometimes our leaders fall prey to that as well, that we go and overemphasize. When I'm the Prime Minister of Uganda and I go to Busia, I would sing more about the 1 million I'm giving people, or the government is giving people. I will not emphasize the road infrastructure under construction. If you look at today, main roads, the district roads, the sub-county roads are getting better and better. For those of us who travel around the country, there is better connectivity that a producer can easily reach the market. Let us look at 10 years ago, before even PDM, the whole of that Bunyoro didn't have a single tarmac road, except the one from Chiboga to Hoima, and then the one from Kafu to Masindi. Today got there. I remember those days, people were selling warrage, this crude warrage, in jerrycans, putting them in lorries to take them to South Sudan. From Karoma to Bibia to Nimule, there were no tarmac roads at all. Today there are tarmac roads there. I remember people were putting on pigs for pork. Nobody was producing pigs or pork in the whole of Western Nile region for commercial purposes. All were coming from Bunyoro here. Today the country is more connected. There's more electricity connected and actually being used. So for me, all these 7 pillars are at interplay. But I think what we need to appreciate also is that social transformation is not a stop clock. That you say, let us not give people money, let us start with mindset. I think some things you do simultaneously. You may achieve 50% in some of them, say 70%, and perhaps 30%. But there's some work going on. Now, about the president, and I want to respond to Honorable Mukasambide. Moses here is the principal man for the president in many of these things, actual groundwork. Moses actually profiles the country. He brings raw data, analyzes, and that's what informs the itinerary of the president. Which district to visit in a region, which sub-county to visit, probably which farmer, which PDM beneficiary to visit. Now, the president will visit a PDM beneficiary, but will also take that opportunity to visit a model farmer who may not be a beneficiary of PDM. He may even visit a politician who is also doing something as to have a demonstration effect, like he has done with recently with the minister Biamokama and many others. Yes, because of the nature of our politics, you may find a situation where if the president goes to Teso, for example, and the Speaker of Parliament, the Right Honourable Speaker of Parliament, or the Vice President of Uganda influences the itinerary. And you cannot tell the Vice President not to influence the President to visit, for example, her farm, where she's doing something. And when the President visits the Vice President's farm, there are many villagers who will go there. They will also see that it is possible for somebody in the northmost Teso district of Katakwi, bordering Karamoja, where everybody hears Karamajong, Rwasuras are making it unsafe to rear livestock. And they will see that actually on the borderline with Karamoja, somebody is actually keeping livestock for commercial purposes, and they are beginning to get money. So, yes, there are instances where the president will visit a PDM beneficiary, a model farmer, a local politician who is doing something good, and a big person doing something good. And I think that mixture helps the country, helps the president to have a picture of what is going on in the country if the country is moving forward. And I can tell you, me as somebody who in the last 1.5 years I've been in Northmost Teso, I can tell you, for example, that region, because of this PDM, Kapelebiong, I'm in a place called Alongatuko. You go behind the district headquarters there, and where nobody had ever seen somebody doing something organized for money. And I can tell you, we are there now creating an example. I'm not a PDM person, but I'm seeing other PDM people there who are doing something. Now, the other thing is, people should appreciate that this PDM is feeding into other ongoing government programs. For example, the university education. We may have faults with university education, that there's a good enrollment, but the outcome, like the president himself has recently gave statistics. He said, if you go to Karamoja, the children who enroll in the P1, only 21% reach P7. Karamoja, you can blame it because of the instability of the institute there. But there's some place called Busoga. They have never had any war, except a small incursion of Lakwena up to Magamaga.
So
but
they should
the
be going
outcome
to
is
school.
not as good. Or even in Buganda here, where war ended like 38 years ago. There are districts in Buganda that were not touched with the war, and so on and so on. So people need to appreciate that PDM and other government programs feed into ongoing programs. If the education is not successful,
thank you.
If health is not successful, PDM is unlikely to succeed the way we want it. And therefore, it is in our collective interest that we pay attention, particularly to the programs that touch on the majority of the population.
Thank you.
Primary health care, university education,
what
road
do you
access,
take from discussion
water
on the
access,
table?
energy access.
Thank you so much.
No, we have today in the country, let me just conclude with this. We have spread electricity grid, and you go to places and cables are passing over people's homes. Or somebody has simply put one bulb, and yet the government effort is, if electricity has passed there, don't just light your house, put a cottage industry. Maybe the support systems are not as strong yet, but there is progress being made.
Moses,
yes.
What do you take from discussion on this table?
Well, thank you all for expounding on the other pillars, the pillars. That's why I said I'll leave that to
Malcolm did as well.
Malcolm also did. But see, Malcolm was saying as if they're not working, but what he's telling you, the infrastructure, the social services and education and health, and maybe Ministry of Gender, they're already there. The question now is coordinating them at parish level.
Even the fact. That's okay. Let people, even the people just getting used to money. Look at members of parliament. When they just come, how many of them would have got that kind of money? No, let us just look at privatization and liberalization.
You see, Oponopondo, we only have 8 minutes to the end of this
where
show.
the government is not there.
Yes.
The fact that there are village clinics being run by people who have their own money and are able to employ professionals.
We have 8 minutes to the end of the show. I want Moses to use 2 of those minutes.
Now, somebody was asking who designed PDM. PDM is a part of our manifesto. Another manifesto, it didn't just come out of the air. Of course, the president as a leader, he was involved. And by the time the manifesto comes out, it has passed through many hands and leadership. So it's an NRM design, I can say. When you talk of, Mukasambide here was asking, who does the president visit? You see, we send a REC team to a region, involving security, political, and others. They meet the leadership of the area. Like now, when the president is going to Ankole next, in fact, we've already finished wrecking Ankole. We are now doing Renzori and Toro next week. Now, they meet with the leaders. They know the leaders propose the area, the people should be met, the farmers who should be met in that area. Our teams goes to that parish and meets the farmer and meets all the beneficiaries in the of PDM in that parish. Meet all of them, and they agree that we should go and meet the farmer. The lead farmer in the area is Mukasambida among ourselves. Because in the parish we're finding now about 200 beneficiaries. They all met. Then we say, okay, let's have another 10 farmers within yourselves who will be around when the president is meeting the lead farmer, and they select among themselves.
So, Moses, I'd like you to choose one big sentence that you should have, and we conclude with that.
One big sentence is that PDM is a success story. There there could be there are challenges there are challenges, but getting people into the financial inclusion is very good. For instance, look at OWC when we are distributing coffee seedlings. Today, Uganda is earning $1.4 billion from the export of coffee, which coffee came through OWC programs. Now, so with the PDM, we are going to have more goods, more crops, more for export, more crops internally. You see, Uganda is the leading food producer in the region. Kenya buys a lot of food from us. Tanzania is buying some food from us. South Sudan buys food from us. Congo buys food from us. So by involving ourselves in this program, we are going to benefit as a country, and the GDP of Uganda per capita income will grow.
Thank you. Very quickly, just 1 minute each. 3 lawyers on this side, starting with you, Honorable Mukasa Mbide, Kiza Besigye.
Yes, I think it is a judicial notice that Dr. Besigye's health is not the best for purposes of keeping in prison. The avenues have been, of course, lawyers have tried their best.
There's also a hanging over his head.
Pardon?
There's also a hanging over his head.
Yes, all avenues I think have been done by his lawyers to obtain his freedom. In Uganda, fortunately or unfortunately, everybody, whether you have been caught red-handed or not, you are presumed innocent under the law.
Okay.
Until courts suggest otherwise.
1 minute, Dr. Kiza Besigye.
So he should be given his due freedom.
Oscar, we saw everybody here, including the people who mistreated Segirinya and denied him medication in jail, come out to mourn and even organize a funeral for him. It is really sad that we have these people in our society who are cynical to a point of seeing someone die right in front of us, go on to let them die, and then start crying fake crocodile tears at their funeral. Okay. So before we get to that point, we've just had one politician die that way. Let's not have another one die that. It's never worth it.
Malcolm, Dr. Kiza Besigye.
No, I echo the sentiments of my colleagues that he's and I don't know why the government chooses to create more drama for itself, because this is a self-created challenge. It is self-made, and it's within their powers to do something about it. Even with that hanging, you begin to wonder, that is hanging over his head, pun intended, you begin to wonder whether that is the whole point. At the end of the day, there is no Kiza Besigye at all.
Dr. Kiza Besigye.
Well, I thought Kiza Besigye had somebody called Martha Karua. The Ugandan lawyers were so unable to help him out, and they hired an expert in the name of Martha Karua.
Often I'll be crying crocodile tears.
I don't intend to. Well, Besigye has his lawyer in Martha Karua. I don't think we need this discussion to save him from his legal troubles. No, I don't think. Well, you can call it political.
Nafi's microphone is off.
Well, yeah. As far as I know, Besigye was charged with an offense. There has been a dispute whether the court-martial is the right place to try him, and they are his lawyers. From external jurisdiction, because the Ugandan lawyers disqualified themselves that they have no competence to handle that matter. Yeah, yes, okay. by going
Moses
for you disqualified yourself. No, please don't come on radio. Don't come on radio and try to argue that case. You hired another lawyer in the courts. Please go and argue that case in there. If he dies in prison, surely he won't be the first one.
I give my minute to Ofono Pondo.
You have given your minute to Ofono?
Yes.
We object. Why is the president of...
We want your minute.
Why is the president...
So...
Why is the president of Law Society in hiding?
Thank you so much, listeners of Capital Gang. Thank you, Stark Cafe for powering the gang. As you can hear, the show is ending on a huge note. Thank you, Mega Yogurt. When Moses comes to gang, we have Mega products as well. Thank you, Malcolm Pamizo, Marianne Kasule Nafka, Honorable Mbide Mukasa, Fono Pondo, Moses Biarohanga. I am Oscar Semoya Msoke, and I shall see you next week.